Hi everyone, our project is on the transcatheter heart valve. Here's some information about the physiology of the heart. As you know, the heart has four chambers: right atrium, right ventricle, left atrium, and left ventricle. So pathway of blood flow: venous blood returns from the systemic organs to the right atrium. It next passes through the tricuspid valve into the right ventricles. And after passing through the pulmonary capillary beds, the oxygenated pulmonary venous blood returns to the left atrium. And the flow of blood then passes through the mitral valve into the left ventricle and is pumped through the aortic valve into the aorta. So there is a valve through which blood passes before leaving each chamber of the heart. The valves prevent the backflow of blood, and they are actual flaps that are located on each side of the two ventricles. They act as one-way inlets of blood on one side of a ventricle and one-way outlet of blood on the other side of the ventricle. And there's four types of valves: tricuspid, pulmonary, mitral, and aortic. So after the left ventricle contracts, the aortic valve closes and the mitral valve opens to allow blood to flow from the left atrium into the left ventricle. As the left atrium contracts, more blood flows into the left ventricle. When the left ventricle contracts again, the mitral valve closes and the aortic valve opens, so blood flows into the aorta. So why does heart valve disease occur? One reason is regurgitation. That's when the valve does not close completely, causing the blood to flow backward instead of forward through the valve. Another reason is stenosis, and the valve's opening becomes narrowed or does not form properly, inhibiting the flow of blood out of the ventricle or atria. So the heart is forced to pump blood with increased force in order to move blood through the stiff stenotic valve. So when the heart valves fail to open and close properly, the implications of the heart can be serious, possibly hampering the heart's ability to pump blood adequately through the body. Heart valve problems are one cause of heart failure. And some people are born with heart valve disease, which is called congenital heart valve disease. And then acquired heart valve disease usually involves aortic or mitral valves. So although the valves are normal at first, problems develop over time, and it's more common among older people. As we age, our heart valves can become lined with calcium deposits that cause the valve flaps to thicken and become stiffer. So many people with heart valve defects or disease don't have symptoms. For some people, the condition mostly stays the same throughout their lives and doesn't cause any problems. For others, heart valve disease slowly worsens until symptoms develop. If not treated, advanced heart valve disease can cause heart failure, strokes, blood clots, or death due to sudden cardiac arrest. And it can seriously increase the person's risk for sudden death or cause rapid development of problems in and around the heart that can become fatal without treatment. And it's the leading cause of death in the US, killing more than 600,000 Americans each year. More than 5 million Americans are diagnosed with heart valve disease each year. Calcific aortic stenosis is the most common cause of aortic stenosis. And while up to 1.5 million people in the US suffer from AS, approximately 500,000 within this group of patients suffer from severe AS, which is an estimated 250,000. And then estimated 80,000 to 85,000 AVR procedures are performed every year in the US. So what is a transcatheter valve? So this minimally invasive surgical procedure repairs the valve without removing the old damaged valve. Instead, it wedges a replacement valve into the aortic valve's place. This approach delivers a fully collapsible replacement valve to the valve site through a catheter. So once a new valve is expanded, it pushes the old valve leaflets out of the way, and the tissue in the replacement valve takes over the job of regulating blood flow. So there are ways you can perform this procedure. One is called the transfemoral approach, and there's another called the transapical approach. So the first successful TAVR procedure was performed in France in 2002. The Edward Sapien transcatheter valve received CE mark for commercial sale in Europe in 2007. To date, more than 45,000 patients have been implanted with Edwards transcatheter valves by multidisciplinary heart teams worldwide, and it's the only FDA-approved TAVR therapy in the United States. So usually, valve replacement requires an open heart procedure. And a TAVR procedure is not without risks, but it provides beneficial treatment options to people who may not have been candidates for them a few years ago, while also providing the added bonus of faster recovery in most cases. And the Edward Sapien transcatheter is delivered via an incision in the leg, or the transfemoral procedure was first approved in November 2011 by the FDA. In October 2012, the FDA approved an expanded indication to enable the treatment of high risk patients and also approved a new delivery method called the transapical approach. And the Edwards Sapien valve is designed to replace a patient's disease native aortic valve without the need for open chest surgery and without stopping the patient's heart. And TAVR is a fairly new technology. So, a study compared transcatheter versus surgical aortic valve replacement in high risk individuals. A total of 699 individuals are randomized to receive either TAVR or surgical replacement, with the primary endpoint of death from any cause at 1 year. The 30-day mortality rate was 3.4% for TAVR group and 6.5% for surgical group. And at 1 year, it was 24.2% and 26.8%. The Edwards transcatheter valve is mounted on a cobalt chromium alloy frame and has several advantages over its predecessors. Perhaps most importantly, it has a lower profile, allowing for implantation in patients with smaller vessels and reducing the risk of vascular injury. So not only does it replace your failing surgical valve, helping you feel better, but it helps your heart work better. It may also shorten your recovery time compared to open heart surgery, so you can resume everyday activities more quickly. Here's a comparison of TAVR to surgery. And then currently there are two devices that are dominating the market right now, the Edwards Sapien and the Medtronic core valve. So according to results, the balloon expandable Sapien XT was successful in 95.9% of patients, while the self-expandable core valve succeeded in 77.5% of patients. While there was no difference in 30-day cardiovascular mortality, a new pacemaker was required half as often for the Sapien XT, and the Sapien XT also boasted more common improvements in symptoms and quality of life measurements. In Bloomberg's coverage of the studies, aortic regurgitation occurred in 4.1% of Sapien XT patients and 18% of core valve patients. Here's some more info about the Edwards Sapien XT heart valve and its design. And then the Carpentier-Edwards Thermofix process helps prevent calcification. And it's the only anti-calcification treatment that removes both calcium binding sites. And then this is a short video on the technology. You can copy and paste the link onto your browser. So here's some Medicaid data. So the most common valvular abnormality in the US is aortic stenosis, with an incidence of approximately 5 of every 10,000 adults. So as our population ages, AS prevalence will continue to increase. There was a study in which 26% of participants, men and women over the age of 65, had a degree of aortic stenosis. Symptomatic severe aortic stenosis carries a poor prognosis. On average, the survival is 2 to 3 years after symptoms develop, with a high risk of sudden death. The most common cause of aortic stenosis in adults is calcification of the valve. So in May 2012, the CMS required all hospitals performing TAVR to capture clinical information in a registry as a requirement for Medicare coverage. The overall in-hospital mortality rate was 5.5% and the stroke rate was 2%. If this occurs, we recommend that CMS limit coverage to patients considered inoperable or patients for whom traditional aortic valve replacement carries a high surgical risk. CMS should also limit the procedure to facilities where operators and infrastructure elements are appropriate. And here's some market data for annual TAVR revenues by patient group 2011 to 2020. So for a market already worth close to $1 billion, this additional growth translates to an extra $400 million in annual revenues by 2020. Assuming the approval of an intermediate risk indication, the US TAVR market is expected to reach close to $1.8 billion within 5 years. So TAVR is covered for the treatment of symptomatic aortic valve stenosis when furnished according to an FDA-approved indication and when all of the following conditions are met. So the procedure is furnished with a complete aortic valve and implantation system that has received FDA pre-market approval. And 2 cardiac surgeons have independently examined the patient face-to-face and evaluated the patient's suitability for open aortic valve replacement surgery. And both surgeons have documented the rationale for their clinical judgment. And the patient is under the care of a heart team. So Edwards Lifesciences in 2004 enabled rapid improvements to the TAVR bioprosthesis and delivery systems and the development of new approaches. The Edwards Sapien valve consisted of a tri-leaflet bovine pericardium valve, pre-treated to decrease calcification and mounted in a balloon expandable stainless steel stent, and became available in 2 sizes. And the delivery system incorporated a deflectable retroflex catheter conceived for the transfemoral retrograde approach. Simultaneously, the minimally invasive transapical approach was developed with use of another delivery system. Here's Edwards transcatheter valve history. You can see the improvements that were made. And then here's another look at its history. And this is the Edwards complete kit with the delivery system. And here's more information about the delivery system. And then Edwards Lifesciences owns a lot of intellectual property, including the implantation of a valve prosthesis, low-profile transcatheter heart valve, transapical delivery system for heart valves, and CDRH regulates the Edwards Sapien XT. It is a Class 3 device, and as I said before, its current main competitor is Medtronic, and here's a table comparing the two. And then we expect competition to intensify over the next 5 years as other companies enter the market. And what the future holds. So in the future, balloon pre-dilation, post-dilation may not be required, potentially reducing complications. And TAVR benefit may apply to lower risk patients, thus increasing the demand and expanding the market. 3D imaging to accurately determine valve sizing. Distribution of AS patient treatments 2015 and 2020. Here's some information about their business strategy. And these are conferences where you can learn more about TAVR and its technologies. And that's it. Thank you.